I'm thrilled to welcome our co-moderators for our 2022 Los Angeles Neuroendocrine Tumor Patient Education Virtual Conference. They are key figures in LACNETS who serve and care deeply about the neuroendocrine tumor community. I'd first like to invite each of you to introduce yourself, and because hearing the word cancer is often a loaded term, difficult one to hear, and one we might attach meaning to, I'd love to hear from each of you what NETS means to you. Dr. Hendifar, welcome, and let's start with you.
Thank you, Lisa, for the kind introduction. My name is Andrew Hendifar. I'm a medical oncologist and NETS specialist at Cedars-Sinai Medical Center. So NETS means to me people and patients with a disease that is incredibly variable and interesting. They're zebras, of course, beautiful and fascinating.
Thank you, Dr. Hendifar. It's great to have you. Dr. Lee, thank you so much for joining us as well.
Thanks so much for having me, Lisa, and welcome everyone. My name is Daneng. I am a GI medical oncologist here at City of Hope and co-direct the Neuroendocrine Tumor Program. What NETS means to me is that it's really a challenge. I think there's a lot that's unknown for neuroendocrine tumors, and I really welcome the challenge to really make significant progress in the treatment of this rare diagnosis.
Thank you, and we're grateful for your work in that field. Mary, let's go to you.
Hi, my name is Mary Donlevy, and I have been living with a metastatic pancreatic NET for a little over 17 years now. NETS means to me a community. I'm really proud to be associated with this community, and also a responsibility to help and hopefully inspire newly diagnosed. And also, I always try and add gratitude in. So gratitude for both that community and the chance to help new patients.
Thank you, Mary. We're grateful for you. Beth, let's go to you.
Hi, I'm Beth DeBlase, and I've been living with GI metastatic neuroendocrine NETs since 2016. I'm a friend, an advocate, a NetConnect mentor for our LACNETS community. For me, NETS has taken on varying meanings throughout this path, and from the initial shock, the fear, the uncertainty that we all feel as newly diagnosed, but also transformed into something more profound, a deeper awareness, deeper connections, and a place where I'm able to have and walk along others on this path and be there with them.
Thank you so much, Beth. Thank you for being a friend, and all four of you for being supporters and essential people in our LACNETS community. So in this first section, we're going to address what happens when you're first told that you have NET, or you find out someone you love has NET, which often includes seeing a surgeon and getting many tests done. So I'd love to hear from each of you what you would say to someone who's just been diagnosed with NET. Dr. Hendifar, let's start with you.
Thank you. Yeah, I think it's so important that if you're just diagnosed, that you get certain piece of information about your disease. One, it's really important that you know where the cancer started. You want to know the differentiation, whether it's well or poorly differentiated, the grade, and also you want to describe some of the symptoms you may or may not be having. Those are all very important pieces of information. And if you bring that to your physician, they can tell you a lot about your treatment and plan of care.
Thank you, Dr. Hendifar. That's really helpful. Dr. Lee, what about you?
Yeah, I think what is very unique for patients with a diagnosis of neuroendocrine tumor is that there are a lot of various different types of treatment options, but not necessarily one right answer. What I mean by that is that each individual who is diagnosed with neuroendocrine tumor, it's truly an individualized diagnosis. And the treatment plan for each patient really should be individualized. So really keep that in mind as you go throughout this journey.
Thank you for that. Individualized, just like our individual stripes in the zebra. Mary, let's go to you.
Well, not surprising, our doctors took the medical route, so I'm going to go the emotional route. So I would say taking the time after the diagnosis to really process the emotions that you're going through. Give yourself some time with this because it's obviously a very challenging time. It's okay to feel overwhelmed by the information overload that accompanies your diagnosis, but just know in your heart that you will get through this. Your strength and determination will come from knowing that your diagnosis is only a part of you. It does not define you.
Thank you, Mary. That's beautiful. Let's go to you, Beth.
I always suggest in that initial moment to breathe and take a minute, breathe again, and allow yourself the space and the time necessary to process what feelings and thoughts come up for you. And know in some of these moments that you're not alone, that you can find your people, find your tribe, and that your pack, that you and we are truly stronger together.
Wow, thank you. That's really powerful. And talking about being stronger, our theme for today's conference is empowering you to make net decisions. So I'd love to hear from the four of you. What does that theme mean to you? Dr. Hendifar, let's start with you.
So I think definitely the more information and the more knowledge you have, the more empowered you are. And, listening to this conference, getting involved with LACNETS really is going to give you the information that you need. Now, when the patients and the physicians can bring all their knowledge and information together, you have the formula to make really good decisions. And that's so important.
Thank you, Dr. Hendifar. That's helpful. Dr. Lee, what about you?
Yeah, for me, I would like to just build upon what Mary said and highlighted before. I really believe that this is certainly a critical time in your life. And what this means is that it really requires taking action on this critical event in your life and really saying that I'm in control of the situation and really want to have knowledge to understand the disease in order to potentially maximize outcomes for my diagnosis.
Thank you. Wow, that's helpful. Mary, let's go to you.
So I would say probably the greatest power you have over your disease will come when you actually do recognize that you're not in control of the diagnosis, but you do have significant control of your treatment decisions. Fortunately, and sometimes disconcertingly, NETS comes with an array of treatment options. For this reason, you really need to be doing your homework, looking into second opinions, getting involved in advocacy groups like LACNETS to aid in your support. Make sure to build, this is so important, make sure to build a NET medical team that you trust and listen to your instincts on this one. And last but not least, and a really hard one, is to be okay relying on loved ones in a way you probably never have previously.
Some wise words, Mary. Thank you for that. Beth, let's hear from you.
Thank you, Mary. Being able to rely on people in a different way really resonates with me as a patient and a once newly diagnosed patient. I think we realize all through this path that we gain a evolving resilience that can empower us to have choice. We as zebras may not have chosen this path that we're on, yet we can choose to look where and what we have already overcome so that when we do look forward to our future, we can take that and gain a sense of making choices without fear, looking to the future and knowing that the path that we set for ourselves now comes from a place of choice.
Thank you, Beth. And thank you all for you for sharing those insights and words of wisdom. So now we're going to introduce our first segment for today.
As a NET patient since 2005, I've had many opportunities to educate friends and family about my NET diagnosis. In my experience, it can be pretty challenging to explain the complexities of this very unique and rare cancer. I find a lot of my fellow NET patients say the same to me. So for this reason, LACNETS put together this video on what NETs means to you for you to share with your loved ones and help them gain a better understanding of your diagnosis.
I am grateful to be able to introduce you to our next speaker, Julie, who's going to share her story of being newly diagnosed and how the power of advocacy and support has helped her through that path.
I'm very excited to introduce Dr. Kalicia Clark, a surgical oncologist from the Medical College of Wisconsin. Her talk is titled NET Surgery, Making Decisions and Preparing for Surgery.
And I would like to introduce our next speaker, Dr. Nina Vijay Vergia, who is a medical oncologist and specializing in neuroendocrine tumors from Fox Chase Cancer Center. And the title of her talk will be NET Testing, the what, when, how, and why.
As a patient, I often am asked, what is a NET? I mean, what is it that you have? What type of cancer is this?
I've been explaining what NETS is to family and friends for a number of years now, and I found it pretty challenging due to the unique complexities of our specific cancer.
NETS has been the process of learning how to engage with that initial diagnosis of a tumor cancer, and then realizing and trying to explain to friends and family that the words remission or you look so healthy don't necessarily always apply to our unique category of disease.
You kind of have to go to the right places to get to answer some of the right questions, and sometimes you're not even sure what question to ask.
This is not the cancer that everybody's used to hearing about, especially a patient that has pancreatic neuroendocrine tumors. This is not pancreas cancer. A neuroendocrine tumor of the rectum is not what you think about when you hear rectal cancer.
Most of the time when patients develop cancer, it's in the lining of their internal organs. And the lining of the internal organ yields a cancer called adenocarcinoma. So 95% of the time, that's what we're talking about. However, about 5% of the time, there are hormone-producing cells that are either heaped up in your glands or it can be scattered in your organs like your lungs or your small bowel. And those hormone-producing cells grow for whatever reason, we don't quite know why.
These are tumors that are produced by special cells in the body called the neuroendocrine cells. The way they call neuroendocrine is because they produce hormones, which can produce the symptoms that we talk about.
They're slower growing cancers than other cancers that we care for, and they're cancers that can start anywhere in the body. I always tell my patients there is nothing they did or didn't do to get this problem. We truly don't understand why they develop. There tends to be nothing that we can see in the environment or in the diet. Very, very rarely or from an inherited gene, but that's super rare.
Most of the data that you will read online about lung cancer and pancreas cancer and rectal cancer, colon cancer, really does not apply to neuroendocrine tumors.
And neuroendocrine cells are the cells that actually make hormones, because we have neuroendocrine cells all throughout our body.
And because they're slower growing, sometimes we don't know that they're there until much, much later than when they developed.
So compared to traditional cancer we might hear about, they take years and years to get to the point where they are, and people can live with those cancers for years to come.
They cause everything that a typical cancer does, and actually more, because sometimes you have hormone symptoms that come with it, and that's an extra added burden which most other cancers don't have. But here, instead of things happening in a year, 2 years, it just takes longer for most of the things to happen.
And so I think the thing about neuroendocrine tumors that's maybe different from other types of cancers is the heterogeneity of them.
They can make hormones or biochemicals that can make people feel sick, and that might influence the way that they feel and their quality of life significantly. Because of that, we treat those tumors or cancers in very different ways, where the goal is really about getting control of the disease, much like we would control of a chronic disease like diabetes or hypertension.
It's still cancer. We have to treat it accordingly. We have to manage you accordingly. And it's something that we can deal with, but it needs to be dealt with.
Most patients with neuroendocrine tumor can live long, healthy lives, even if they have more advanced disease. And so not all hope is lost, and they just need to get into the right hands with the right group to get more information about their specific tumor. And then that will tell us a little bit about how long you're going to live and what treatments we can give you to try to extend that as much as possible.
We may not be able to get rid of all of it, but we might be able to control it for years to come with different type of treatments. That might involve a lot of different therapies, either combined together or sequenced together over time.
While NETS isn't often curable, it is treatable. And the treatments aren't like other cancers, where your hair falls out and you lose a lot of weight. There isn't a clear algorithm, and people are often in and out of treatments. And there's often a lot of decisions to be made.
But I think the most important aspect of neuroendocrine tumors is looking into the type of neuroendocrine tumor you have and understanding how that's going to impact life over time.
Going to a doctor that really understands the disease is critically important so that we could better understand your tumor and what we need to do for your disease.
It does have a rich community of people diagnosed with the disease, and so I think really reach out to others to learn more about the disease.
So definitely talk to the NET advocacy groups, physicians, and other patients to kind of get more information to really get started on this path that you're heading on.
My husband is living with the same type of cancer that Steve Jobs and Aretha Franklin had. But while celebrities might have made NET famous, it's important to know that there are about 180,000 people living with neuroendocrine cancer. So it's not as rare as previously thought. The challenge is learning to live a new normal with the disease, because it is possible to live richly and fully and to thrive despite living with neuroendocrine tumor.